Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 124,896 confirmed cases of COVID-19 in Canada and 41,048 cases in Ontario. Chatham-Kent has 356 cases and Sarnia-Lambton has reported 338 cases. Michigan now has 96,792 cases, with 13,421 cases being in Detroit. Today, we are reporting 2,470 cases of COVID-19 in our community, an increase of 4 cases from yesterday. 3 are residents of a retirement home, and 1 works in the agri-farm sector. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39. 65% are male and 35% are female. We are saddened to report the death of a member of our community, a gentleman in his 60s. Our thoughts go out to his family during this time. Our community has lost 72 people to COVID. 50 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak, as well as 2 workplaces in the agri-farm sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain. If you're feeling confused or losing consciousness. Windsor-Essex will soon have 3 COVID-19 assessment and testing centers: Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Drive-through testing will be available today and tomorrow, adjacent to the St. Clair College Sportsplex from 9 to 4. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online testing portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated the test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from CTV?
Yes, good morning, Teresa. Happy Monday.
Hi, Bob.
Not so happy, I guess, with the death of the man in his 60s. Can you give us a few more details? Like, was he a long-term care facility? Was it a community transmission? Do you have any more details like that you can provide us with?
The gentleman was residing in a retirement home and did pass away in the hospital.
Okay, was this one of those things where it was brought into the house, or do you know details like that?
Well, we have been working with two homes right now that are in outbreak, and yeah, I don't know all of the specific details, but
okay.
I know that.
Did he catch the virus recently? Was it a quick thing?
I believe it was.
Okay. And I heard you on the Dan McDonald show this morning. I'm not going to steal everybody's thunder, but if you can just give me, just kind of your thoughts on the injection sites. I know you want to put it downtown, so, I guess the Coles notes if you would, and then, I'll let everybody else pick up on the rest of it.
Well, on Friday, we released a media statement or a media release about our expression of interest to a landlord or an owner 4 potential sites for a consumption and treatment services site. As you are probably already aware, about a year ago, we did a community consultation, and we are moving forward with submitting an application to the Ministry of Health and also Health Canada. And in order to complete the application, you require the actual location to be identified, and site maps and all of the information has to go into that application. So during COVID, some of this work was put on hold, but we want to move forward with it. We want to try to get this application submitted, and the work of the selecting a site and doing all of the community consultation that results from that selection has yet to occur. So we are moving forward, and that's essentially the story.
Okay, thank you for that. I'll let everybody go at it now.
Any questions from Windsorite?
Not at this time.
Any questions from CBC?
Yes, good morning, Teresa. What's happening at New Beginnings? Is these, over the weekend, there was 7 cases, positive cases there, today a few more. Are you seeing more cases because there's more testing being done?
Our health unit is working with the retirement home very closely, and the cases that we're seeing is a result of an identified outbreak where there is transmission right now in the home, and that's what's happening and has happened with other retirement homes. We continue to work with them. We have supported them with different needs throughout this outbreak, but there are some challenges for sure.
And for the application for the new site, why now, I guess? A lot of other cities and communities have been a bit quicker to adopt these types of sites. Why is Windsor, why is the health unit doing this now?
So the consumption and services treatment site, this work was part of the Windsor-Essex community opioid and substance strategy as part of the harm reduction pillar, or the strategy to reduce opioid overdoses and deaths in our community. And so this work started well over a year ago with the community consultation. And I would say it probably was released last September, the consultation. And our board supported us by allowing us to hire a coordinator to move the applications forward. What happened is, come January, when we were moving forward and getting everything in place and completing the application, we had met with many community partners to make sure the application was as complete as possible, which really includes a lot of pathways to care, such as primary care, mental health and addictions, and harm reduction, supplies and access. So all of the components of the application were completed, and the final piece that was not completed was the identification of a site and what that would look like. So when COVID hit, everything was kind of put on hold, and in recent months we have resurrected that work to get everything moving again, because it is still a priority and has been for our community. The selection of a site will just be, if we get multiple sites, we will be working with all of our partners and the police to identify safety and security and do community consultations. And we would be proposing a site that to our city as well, and to our Board of Health, because it has to be approved by both of those people as well. And then the application, if it's included in the application, we're hoping the application gets approved, and then things can get moving for our community.
Thank you, Teresa.
Any questions from EM 800?
Teresa, going back to the retirement homes, just wondering, is the health unit concerned that this outbreak or the outbreaks are happening at retirement homes because an individual that's going to visit a loved one might have the virus and they're not sure they have the virus? Anything like that?
I'm not exactly sure of all the details of particular retirement homes, but there is a lot of surveillance testing happening at retirement homes and long-term care homes of staff and residents and people that are visiting. So I'm not exactly sure what, how this outbreak occurred, but our health unit, as we have, since the beginning of the pandemic, have been dealing with all of the infection prevention and control measures, staffing, PPE, all of those issues are all being addressed with the retirement homes. Retirement homes are a little bit different than long-term care homes, which typically have different regulations and probably more supports than retirement homes. But it is unfortunate, but we are working with them to support them as much as we can and to try to decrease this transmission.
Just a refresher here, if I want to go visit someone in a retirement home, I need to get tested before I go, right?
I believe that it's no longer a requirement, although many people continue to do that to protect their loved ones, but I believe that requirement was lifted.
Was that lifted when we moved to stage 3?
I think it was before that because there was a kind of concern about the logistics of it, the ability to get a result and, to have a proof of a result and just the timing of everything. So that did get changed, but I don't know the exact date, but it's been a little bit.
Okay, thank you.
Any questions from Blackburn?
No, thank you. They've all been addressed.
Any questions from Windsor Star?
Good morning, Teresa. Are you aware of any challenges particular to the retirement home experiencing the current outbreak? Is there anything different going on there than the health unit has seen before in the other retirement homes that had similar things happen?
Unfortunately not. There's no, what we saw at the beginning of COVID continues to be challenges with retirement homes, long-term care homes. We see this annually with influenza outbreaks and with COVID. We're seeing similar issues. I do think that we're working very closely with the retirement home and making sure that they have the supports that are needed. But unfortunately, they do have cases, and we are working with them, and they're doing the best they can and adhering to all of the advice and the follow-up. But it is unfortunate.
And as for a consumption and treatment services site, if there were no expressions of interest put forward, theoretically that would mean that we wouldn't get a site, yes?
So if there are no one is interested at this point, we'll have to figure out Plan B and see where we go from there. But this expression of interest did get posted. I think it was August 7th. We posted it to Merck's, which is our typical procurement website, and we did not get any interest at that time. And so using our media partners, we are hoping that this will bring it to the forefront, and people that are able to possibly submit a location will be able to hear about it through the media and go on Merck's and have a look at that.
Are you confident that you will get some expressions of interest once more people are aware of that opportunity?
We always knew that the site location would be a contentious and challenging issue, but we are hoping that if there are interested owners or landowners, that they will even come to our question and answer session, which is August 28th, and ask those questions and bring forward any concerns or any further information that they might want to have before they submit.
Thank you.
Any further questions from CTV?
Yeah, Teresa, just one more. What is your ideal timeline for submitting?
So the submission for the expression of interest is due September 4th. And, but for the actual full application, we wanted it to be, I have to be honest, pre-COVID, we were looking at September. Now we're looking at trying to get this submitted by the end of 2020.
Okay, great. Thank you for that. Have a good day.
Any further questions from Windsorite?
No, thank you.
CBC?
No, thank you.
AM 800?
No, thanks.
Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone.